Well, it is now my pleasure to welcome to the podium IADR President-elect Jenny Gallagher, who will talk to us about partnership with purpose. Welcome, Jenny.
IADR President Pam Yellick, AADOCR President Effie Ionadu, and President-elect Nisha De Silva, CADR President Leah Rock, Chief Executive Christopher Fox, board members, colleagues, students, and all members of IADR and our visitors. I am deeply honored to have been elected to serve as the 103rd president of this remarkable organization. IADR has shaped and inspired me over several decades through my move from Ireland to England, my development as a clinical academic in dental public health, and my engagement in international affairs. I want to pay particular tribute to our CEO, Chris Fox, for his tireless leadership and global impact, and to the IADR staff whose dedication and professionalism make these congresses possible. I look forward to assuming the presidential role at the conclusion of this general session. The IADR for Dental, Oral and Craniofacial Research is built on partnership. Our divisions and sections across 5 regions, together with our themed groups and networks, form a global web of collaboration. Today, I want us to reflect on how we can deepen these relationships and truly partner with purpose. For more than a century, IADR has championed excellence in research. From its origins as an all-male group of North American scientists, it has grown into this diverse global community, shaping the future of oral health through research with impact. It is wonderful to gather here over the coming days to celebrate science together. And as we do so, we remember those colleagues who cannot be with us. And at this challenging moment in history, the words of William J. Geese, our founding president and founding JDR editor, remain powerful as we embrace our mission and vision. Research, in its highest expression, is open-minded inquiry for truth, to be found and revealed unreservedly for the information, instruction, advantage, and welfare of all. Today, truth and scientific integrity face pressures from social media, technology, economics, and politics. And as a community, we must uphold excellence and support one another in delivering research that benefits all. We have much to do, from navigating the responsible use of AI, defending fluoride as a safe and proven caries preventive measure, supporting the global phase-out of dental mercury by 2034, and innovating high-quality alternatives suitable for all contexts, and advancing the sustainability agenda for dentistry, together with the persistent challenge of preventing and managing the common oral diseases in an increasingly aging population, tackling inequalities and facilitating access to appropriate oral health care. And yet today, we also celebrate the unprecedented opportunity that oral health is firmly on the global agenda. The WHO Global Strategy and Action Plan for Oral Health in 2030 provide a platform for shared action. The first Global Oral Health meeting in Bangkok in 2024 marked a defining moment. The Bangkok Declaration reminded us that there is no health without oral health. Warmest congratulations to Dr. Benoit Varenne and the team at the WHO for their tireless work on the oral health agenda. And oral health was further raised in profile at the recent UN high-level meeting on non-communicable diseases, which recognized the importance of both oral health and mental health, an important achievement. And as we look to 2030, the UN Sustainable Goals are of global importance. You will be well aware that health is SDG 3. But have you noticed that partnerships are at the heart of the UN Sustainable Development Goals? SDG 17, Partnership for the Goals, underscores the value of learning and working together across sectors to support all other goals. To achieve meaningful change, we must collaborate, not only within academia and health systems, but also with industry, policymakers, patients, and communities, often with people who think and operate differently to us. So let me ask you a question. What role will you play in partnership for oral health and well-being? I would welcome your ideas over the coming days on how we can collaborate more effectively and with greater purpose. Let me offer some framing thoughts on different levels of engagement at macro, meso, and micro level. So starting at the macro level, IADR has an important history of working with the WHO and the World Dental Federation to elevate oral health globally. And as Vice President and President-elect, I've had the privilege of contributing to this work in Geneva and at the Bangkok meeting in 2024. Moving forward, IADR will be an active partner in the emerging global coalition for oral health, supporting action by member states. This will be a vital partnership in advocating for oral health and well-being worldwide. Additionally, many of our groups and networks are ideally positioned to advance the global oral health research agenda, Objective 6 on this slide, which supports all the other strategic objectives, from governance to health promotion and prevention, to workforce, care delivery, and health information systems. So can we perhaps better coordinate our research efforts across networks to maximize impact? At meso level, I would suggest that our divisions and sections have a critical role in influencing national research priorities, and we've already heard some of that this evening. Together, we can help achieve Global Target 6 so that by 2030, 50% of countries will have a national oral health research agenda focused on public health and population-level interventions. Such agendas help secure resources, guide research, and ensure that findings translate into outcomes through implementation science, not only in high-income countries, but in every nation. A forthcoming paper on advancing a global oral health research agenda led by Leah Rock and Paul Allison will be most helpful to us as we seek to influence nationally. And additionally, your employing organization will have key partnership agreements with institutions nationally and internationally. Do you know who they are or what they are? If not, find out who you can easily partner with to maximize collaborations for the reach and impact of our research. Equitable partnerships between universities and countries can strengthen capacity, build science, and ensure that no one is left behind. And at meso level, every one of us, regardless of our discipline or where we sit in the research cycle or pathway, we have a contribution to make through partnership. Do not underestimate your influence. Our member survey shows that networking is one of the greatest strengths of IADR meetings. I know from personal experience how transformative these connections can be. So throughout this Congress, during the sessions, lunches, poster discussions, and networking events, listen, reconnect, strengthen the bonds of trust that support collaborations. Reach out to someone new, seek unexpected connections, and identify opportunities for partnership that can advance oral health at scale. Now is an important moment for our scientific community to work together, to deliver excellence, to translate evidence into action, and to drive meaningful, lasting change in support of our purpose of oral health for the world. And as we partner with purpose, I would value your support in shaping what effective, equitable partnerships in research look like in practice, and showcasing examples from across our community. I commit to work to strengthen our partnerships and to serve as an advocate for dental, oral, and craniofacial research across my presidential term and beyond. Can I thank you and wish you all an inspiring and purposeful Congress.